Yeah, good evening to all of you. Is it audible? Okay, fine. So today's session, we are going to cover the topic on strategy in the healthcare industry. So as a part of the agenda, we'll have introduction to what is the meaning of the term strategy. The second one will be strategic frameworks in healthcare. Then we'll look into strategic themes, several themes in the healthcare industry where strategy is used. And we also, if time permits, we can have several case studies where strategic application of management principles are being applied. And finally, we can look into the conclusion and future outlook in the healthcare industry. So let's try to understand the organization of the system. So usually the system is a complex combination of men, materials, facilities, along with equipment, money, then knowledge and ideas that is established to achieve certain goals and objectives. So basically, the systems uh, are certain for profit making, and certain other systems are for non-profit making. For our convenience, we can classify them again into product-oriented systems and service-oriented systems. So in the map, we can see some organizations focus on the techno structure, which are technologically intensive organizations, and there are other organizations which are focusing on support staff. So it is a labor-oriented industry. A good mix and a combination of both techno structure and support staff will have to be followed for the middle line, and the operating core is to provide better services to the end customer. So the strategic apex should consider all the possibilities of handling not only the technology part but also the human resources along with the technology, not in isolation but together. So the who are going to frame these policies? Obviously, the top management and the CEO and the MDs of the organizations are going to frame the policies. And the operating core will be the people who are like nurses, physicians, assistant physicians, public health workers, social workers, and a few other stakeholders. In the middle line will be the managers and supervisors. And support staff will be the clerical workers and data processing personnel, including the AI and the usage of latest technologies, database management, and the IT people. Plus, you also have the maintenance personnel. Then you have the techno structure. Basically, these days, those who are having expertise in analytical area, business analysis, and business intelligence, they belong to the techno structure. Earlier, they were just known as a support staff. Now they are gaining immense credibility. So the mechanism in the organization while deciding the strategy should include mutual adjustment by and within the people. First is direct supervision of people by a designated supervisor. So there could be a one PRO, there could be other people under the supervisor level and entry level staff below them. And for that, we need standardization of work. So together, how many hours of work does one has to do? So standardization of the work and how many tasks have to be bifurcated and listed down, and standardization of work output. So what kind of work it is expected within 8 hours of work has actually 8 hours okay dedicated for that. That is standardization. Then standardization of worker skills. So since skill is a scarce resource, the skilled staff, the semi-skilled staff, and the unskilled staff have to be categorized and accordingly paid accordingly. And the mechanism of the organization has to be taken care so that the strategies will fall in place. Now, who are the other people from outside who are going to help us in order to have various combinations and relationship with other stakeholders? The first of all, the central level bodies, the authorities, the councils, along with medical council, pharmacy council. So central level bodies are there. Then state level organization, public healthcare departments, then health department, Ministry of Health. Then at the district level, you got then primary healthcare, then field level people, including various people on the field. So all these levels of organizations are in touch with the organization. So organization of work cannot be done by alone. It has to be done in group. Any activity, any movement will gain momentum only if all of them are synchronously working with each other. Having said that, since in hospital administration, we know that the level of administration should include basically following the principles of management here. The second one being administration. The first, we understood the level of organization, entry level management, supervisory, mid level, higher level management. Then administration, to take care of that, we have a specific set of people and skilled in that. Then we follow the scalar principles of management, that one person should have a sufficient number of supervisors below them. Down the line, they should have so many other people. Then there should be span of control. As we already know, or may have already studied in business studies, or span of control is the total number of people who are reporting to a particular authority. So how many people are being guided by the one person in the hierarchy? Then there is a techno structure. So how many IT people, professionals are helping, how many business analysts are helping. So that is also being helpful. Then comes the organizational change. So any change will be fought with resistance. Nobody wants to readily accept any changes. So any organizational change has to be done not only through the policy but as a strategy. So it could be operational change, it could be level of tactical change, or it could be strategic change. So three levels of changes can happen. And the operational spheres, operation not in the sense of medical term, but the operations of the entire hospital. So that is operationalization of day-to-day tasks, that is standard operating procedures. Apart from that, tactical way in which the strategies have to be handled, and the finally the strategic level at which one has to study this subject. So as per the administration, what all one has to know? The first of all, they should know the law of the land. Whichever country, whichever state they are working, they should know and read them thoroughly. They should be very much quite updated with the latest happenings in the law. Second, study the needs of the community. So what kind of community they are in, where the hospital is located, what type of people, what is the background of people, what is the sources of people who are coming and forming, who have established the organization, for what purpose they have established. That is getting familiarized with the community. The third will be the evaluate resources available. So what kind of, whether the organization is good in certain terms, like how many beds do they have, how many specialty cares, or specific requirement of multi-specialist requirement and roles they are playing in the society. So all the knowledge one should have for the people who are in administration. Then there are three functions which are supporting. One is the political leadership, then comes the management of resources, and then ceremonial representation. Wherever your organization is being represented, the administration have to participate and show their presence, so that the association level, any changes required in the way in which it should function, they are in congruence with what is expected from them. Then the scalar principle says that the administrative arrangement of functional groups or in units of a scale. So the same hospital may be willing to open multiple organization or subunits. So determined based on the purpose, discipline, and functions of the entire organization. So one can think about the scalar principles of late, but it's in the initial stages it may not be necessary. But of course, at the time of growth of the organization throughout its lifespan, one should think about administration works on various activities and programs which can simultaneously happen for various campaigns as such. Then outlining the facilitative approach to communication. Your communication should be open. There are various apps these days which will make the communication open. So we'll go to that later if time permits. Otherwise, we will handle that in some other class. So communication is very crucial for any organizations to withstand all the impacts of the external environment. Then the span of control. It could be a tall, structure of hierarchy. It could be a narrow organization. It could be done only with the contractual staff, or there could be a single leader with a few programs who are managing with separate directors. So it depends upon how exactly the total organization will be, structured over a period of time. And there could be over a period of time we are finding flat organizations as well. So broad and shallow with many program directors. So it all depends upon whether it has been traditionally following the tall structure or the flat structure, where very recently any kind of innovations with the latest inventions and technological usages in place. So such kind of span of control has to be decided in order to understand what kind of a strategy is required for as far as human resources and the internal staff members are concerned. Then of course the techno structure, it should be assisted with, let us say, there are units, planning unit is there, legal services unit is there. There should be R&D, then there will be financial management services. So all these things in together, they will facilitate the work of administration. So these are all adjuncts to the CEO. There should be supportive staff to the main core area where doctors and nurses are the main criteria. Apart from that, we have all other departments with techno structure. Then they should assist the functional units. As such, the core functional units have to be assisted by the techno structure. Then any change to be brought about in terms of the strategy has to be understood by the reorganization. So which staff has to be reduced and which has to be improved upon to alleviate the external dissatisfaction with the cost of management. Sometimes the cost becomes too unbearable. So the smaller hospital, especially in the tier 2 cities, they are unable to meet their cost. Most of the hospitals in tier 2 cities, they are fraught with so much of escalation of cost. So the larger the hospital, the more chances that it is more profitable. So it is always a case study has to be understood that which are the hospitals are more relatively more stable in terms of their income. Then comes the decentralization, relocation of services centers to save the transit time. Okay, so which are the functions which have to be decentralized, which have to be centralized, because there is a significant gap between the the doctors and the nurses. There's nobody in middlemen who handle all these things in between. So organizational change has to be brought about in order to bring a strategic imperative, in order to have a seamless way of having communication in between. So obviously, when you say management, you have the planning stage initially, then you have to evaluate, then you have to have finances which have to be backed up for the entire set of activities. You should have the HRM department to support, then surveillance in order to handle all the activities, whether they are working smooth or not. Then finally, it is supported by health services marketing. Sometimes people more are hesitant to have the health services marketing, but especially apart from other sectors, or health sector seems to have been laid back in terms of dealing with services marketing. But of late, some hospitals have been doing marketing and contracting. Then the four basic activities are planning, organizing, communicating, and monitoring. So it is the same thing again. I don't have to repeatedly tell you. So the management process will be, first of all, define the aims and objectives of the organization, have the mission, the vision, and the goal for the organization. Next, have strategic, tactical, and operational planning. So at operational level, you have different set of activities. At tactical level, one has to know what are the other competitors who are offering better facilities and services. And the strategic level, you have to know how to overcome those barriers who are posing us such a challenge. So to beat the competition. Next, third one is obtaining material and human staffing and financial resources. So it might happen that some of the hospitals may not get financial backup. It depends upon what is the parent company, which are the other businesses into which they are available already. So financial resources could be limited by the type of company or the evolution of the hospital, from promoters and directors, and how it has been into the present phase of life. So that has to be understood by how much of staffing initially is required, then at what stage after 2 to 3 years, whether staffing have to be renewed and more different set of specialists have to be taken. All those things have to be charted out in the first place. Then ensure training and direct the working. So training is essentially required from experts, from seniors or consultants, who are always welcome for the entire management process to take its course. And finally, the organization structure and the behavior of the people, whether they are ready for change, ready to absorb what is happening in the current trends, all those things becomes a part of the management process. So it's the same thing what was there in previously, the planning, organizing, communicating, and monitoring activities. So now the question is, why a strategy is required for hospitals? Okay, first of all, definition of strategy in the management context, to set right the things which are not in place. Okay, so strategy is nothing but to prove our organization better than other organizations in order to make not only good services in the society but also to make profit out of that. And we have to have a long term vision and the goals for the competitive advantage. So that's why the strategy is required. The application of strategy to service industries is very crucial. Earlier, the manufacturing industries used to have significant level of strategy, but then service industries of late have to be managed strategically, and it receives its own kind of importance in dynamic healthcare environment with all the stakeholders involved in it. So why strategy matters in healthcare is, healthcare as a service driven industry, it is labor intensive, sometimes it is technological intensive, it has high stakes. It is very sensitive industry, basically means whatever happens, there could be high level of fluctuations, and there may be sudden inflow of patients, and there could be exit of patient depending upon how we are going to respond to the coming challenges. So there should be the need for the efficiency, quality, and patient satisfaction. So that's why strategy has to be amicably restored again and again. It has to be revamped again and again. It has to be thought about every year. So strategy has to be done not as one time making like a manual or something like that. Every year, renewal of the strategies have to happen, and more so because the regulatory frameworks and the ethical complexities day by day, they are changing, and the compliance levels are increasing. In order to make a balance for the in terms of costs as well as access and innovation, the strategy is required in the healthcare. Strategic challenges in healthcare, first is rising healthcare costs. So for an ordinary man, affording a hospital which is very expensive has become out of reach. So that is one way of looking at things. Not only education is expensive, but also healthcare is expensive. So both the education sector and the healthcare sector, these two sectors have been neglected since our independence. So in India, especially, education and healthcare has not been getting budgetary allocation, both in central budget as well as the state budgets. So we should know that rising healthcare is only possible with larger facilities, with the elite, with the larger hospitals. So that is one reason why the hospital has to come up with a better strategy so that it can have a outreach program for even those who are unable to afford in the usual course of activities. Second is rapid technological advancement. So with the development of networking, social networking, media, then digital media, apart from that, with a lot of innovations and inventions in technological fields, it will have its own repercussions on the healthcare sector. So rapid technological advancement demands that the organization should be ready with its own level of strategy. Third one, workforce shortages. So all said and done, very people do not still fully realize that there is a dearth of skilled people in the healthcare sector. Moreover, there is a dearth of even the doctors. There is a dearth of hospitals. Maybe in certain states, hospitals are many, but there are many states where there are lack of hospitals, there are lack of doctors for every 1,000 number of people. There is a scarcity. So there is a workforce shortage, in fact. Okay, and there is a requirement of training needs. Then you have the changing patient demographics. So no, patients are not only coming from within India, they're coming from abroad also, because Indian healthcare is quite efficient and uh, within reach. So they want to have certain advanced kind of healthcare services being provided in India. So changing patient demographics in order to understand, their level of requirements and their set of expectations has demanded that there should be some change in the strategy in which hospitals are being managed. Then levels of strategy in healthcare. First of all, you have the corporate strategy, hospital chains and healthcare groups. Okay, at the topmost, all the large hospital chains and the groups which are involved in they form the corporate level strategy at CEO level, MD level, and board of director level. Then comes to the next CEO or the general manager level or the administrator level. That is known as business strategy. So specialty hospitals coming up with their diagnostic toolkits or what kind of a help they have, MOUs with different organizations. That's known as business level strategy. The third one is functional strategy. like day-to-day operation requirements of HR, day-to-day requirements of marketing, then IT requirements. So all that comes under functional strategy. Below that is service line strategy, like every specific department, like oncology, cardiology, ophthalmology, respiratory, and perfusion. So each and every department, like service line strategy, has to be charted out so that they will have the guidelines. They have the procedures, practices along with that, apart from the policies. So policy is something which is evolved, and out of the policies only we are going to create the strategy. So strategies are held at four levels. The topmost level at which strategies are made is the corporate strategy, which is done for all the hospital set of hospitals. Then business level strategy, especially the unit, the specialty hospital level strategies are made, including diagnostics, which are provided and made available at all the places simultaneously, so that there is uniformity in business strategies, so that the general public will have a glimpse of what is there in a specific type of organization. The third is functional strategy, operations, HR, IT, and marketing. The general functions which are obviously there in MBA, in the traditional MBA functions, that is functional strategy. And then service line strategy. So oncology, cardiology, all the kinds of specialty healthcare services. So that is known as service level strategy. Then who are our stakeholders? Okay, all we know, first of all, patients are our main stakeholders. And the people who assist those patients are the caregivers. So both the patients and caregivers are the first people who are the stakeholders. The second stakeholders are healthcare professionals, the doctors and the assistant physicians and the nurses. Then the people who are having guidelines to frame these laws in place. So regulators and government agencies who have to fulfill their level of compliances. So these are the third level of stakeholders, and insurers, investors, and suppliers. So they also have a heavy influence. The insurers will have a dominant role these days. They are trying to have a lot of stake in terms of the type of offerings they will come up with. Even investors and suppliers, they are a crucial part. Suppliers, what level supplies have to be done on a regular basis, what kind of suppliers have to be included, and on an annual basis, who have to be renewed and who have to be given the new contract. So all these are people who have their stake in running the organization. Now, the case in point which we are going to say is about the Porter's 5 forces in healthcare. The first one being threat of new entrants. So it may so happen that a hospital which is built today will have another one hospital competitor in the same city. So there is a threat. Indirectly, it is a threat only because a lot of patients who used to come previously to our hospital may shift to another hospital due to certain reasons. So we should be very aware about who are the new entrants. Second one is bargaining power of the suppliers. So the very early the bargaining is done, a lot of savings will go underway. By the time you can make a lot of profits at the time of purchasing in bulk. So the rates at which the negotiations are happening and the method and the procedures through which these medical equipments and pharmaceuticals are bought, these will pile up over a period of time unless it is checked right from the stage of selecting the suppliers. So bargaining power of suppliers is also one of the external forces which has its own factor which will bear upon the healthcare services industry. The third one is bargaining power of buyers. Okay, what type of patients are coming, whether they are what is their purchasing power, whether they are insured or not insured. Even if they are insured, how much lakhs they are insured, or if they are not insured, what kind of additional benefits they are getting from the government, whether they are considered under some healthcare programs, whether the insurers and patients have the stability in order to repay whatever charges have been borne by them. So that is another factor which will be affected in Porter's 5 forces in healthcare. Fourth one will be threat of substitutes. Telemedicine. These days, to get the access to telemedicine across the borders from some other country, that is one substitute. Telemedicine means something which can be accessed in length of buying, means something which is very close by, near me. It can be accessed from somewhere else also. So there are unknown sources. Telemedicine is there. You can access the services of telemedicine anytime. So we have for DMLT, for various fields, even for surgery also, some telemedicine are playing its own role. And additionally, home care is also available. So in a way, it is a force which affects the organization. People who are offering home care. Next one is industry rivalry. So there could be other set of hospital chains. There is rivalry from them. Rivalry in terms of businesses. So then there could be clinics, other clinics who are providing specialty services. So we should be aware about who are all there, who are our nearest players who are providing services in the same context as which in which our organization is providing services. So this Porter's five forces, a case in point, is one strategy, the one way of looking at things actually. So Porter's five forces is a theoretical model through which you are seeing the organization. It is a lens. Porter's five forces is a type of lens through which you are seeing your own organization. Okay, so in this diagram, you can see it at the center, at the very center, you will definitely see what rivalry among existing competitors. So on the left hand side, you will have bargaining powers of suppliers. On the right hand side, you are having bargaining power of buyers. So all these forces are simultaneously affecting the organization. So on top, you are having threat of new entrants, the newcomers into the industry, or rather the hospitality, healthcare, newer hospitals and healthcare clinics and all those things. So that is what the Porter five forces says. And then down you have threads of substitutes. Okay. So the threat of substitutes and products and services. So all these things are going to have an impact upon already existing rivalry among the existing competitors. So these five forces are shaping the industry's competition, and one has to be very aware and ready to be very able to take a strategic action. So this is just the way to look at a strategy. This by itself is not a strategy. I'm not saying that this is a strategy. This is the lens through which you are going to devise the strategy. So you are going to devise the strategy by accepting this model known as the five forces that shape the industry competition. Okay. So every procedure, every strategy, like for example, first curve orthopedic is the company or the curve, the type of particular specialty. And second curve integrated care, third care, second care, CMS care. So all the strategies are derived because of certain forces which are affecting us. The first force being the rivalry itself in the center. On the left hand side, bargaining power of the suppliers, out of which we have to derive a strategy. Bargaining power of buyers, we have to derive a strategy. Together, you have to combine 2 to 3 strategies and chart out the course of action so that you will end up making a very revised and curated strategy. Next, we have understood so far the external forces which are affecting us. Now, internally, we should be very aware, very acquainted with the SWOT analysis of the organization in which we are working. Obviously, the strengths, the weaknesses, the opportunities with our own organization has, and the threats. Okay, the strengths could be we are good in having a skilled set of staff. That is our strength. The more better our staff members, the more chances are that our organizations will earn more and serve more better. So we are also having the advanced technology. So right, so this is known as the strength. What could be the possible weakness? Resource constraints. The same budget has to be used for different departments. Who has to be given top priority? Another department may not get as much as budget as one of the core operational department gets. So inefficiencies in the supply chain, that is a weakness. We don't have so many suppliers. We may have to buy certain equipment from abroad. We ourselves do not have that specialty equipment. We may have to import it. So all these are weaknesses. Next one, third one is digital health and preventive care. So opportunities are very many in terms of the digital health, in terms of the services which we can render, in terms of the applications we can use in the services of the patient. There could be preventive care by reminding them when is their next round of taking up their care or visits to the hospital. So opportunities are there in terms of communication, in terms of alerting, in terms of preventive care, along with the digital health support systems. Then comes the threats. So threats could be in terms of regulation, which we are unable to comply. Threat could be there during the pandemics, which suddenly come from nowhere. We don't know how it all emerges. The threats can come from rising, fluctuating costs of the fuel suddenly, or there could be some tariffs which are suddenly imposed for import of goods and export of goods. So the better we are aware about the healthcare costs which are increasing, the better we'll be able to address the issues that who can really afford it, who cannot afford it, and how much of affordability can be studied, and what kind of strategy has to be charted out by understanding the SWOT analysis. So the case in point is medical technology industry. So the strengths are patient demographics, whether the patients are young, what is their average age of the patient, what are the demographics, whether they are male, whether they are female. So patient demographics, that itself is a strength. Okay, patient, how the patient is, that itself could be a strength. Next one is outcome impactful and immediate. Okay, whether they need to be hospitalized just for 1 or 2 days, or they should be sent out within specified number of time. Next, last line of defense. Okay, so who is going to take care of in case of emergencies and all? Next, emerging market need. Is there any specific need which is come up in the market that has to be implied, or that has to be executed or implemented in our system in the hospital? So these are the possibility of strengths. Okay, it was taken from US in 2011. And weaknesses, time to market will take a long time. Hospitals are not that eager to market themselves, nor they are going to be easily bought or purchased by somebody who knows the hospital. Despite knowing the hospital, they may feel it uncomfortable to afford it. Next, complex purchasing environment is there. We don't know exactly why a particular patient goes to a particular hospital, because there is a complex purchasing environment. Okay, then there could be serious pricing gaps between the prices which the one set of doctors are charging and another set of doctors are charging, or the hospitals are charging. And there could, on top of that, we are having the government influence. So these are the areas of weaknesses which one has to consider these while framing our internal strategy, that is strengths, weaknesses, and opportunity and threat. All the four normally could be more or less based upon the individual organization. Whereas the previous model which we have seen, the five portals, five forces are from outside, this fourth is from within. So opportunities, new business models, new treatment areas are opportunities. What way of newer treatment have to be introduced, what has to be launched, consumer driven influence. Okay, how many consumers are likely to be there? Okay, whether there should be a cancer center, or there could be centers for various, you know, serious ailments, terminal ailments, all those things. So consumer driven influence is there in terms of opportunities, which will determine what kind of facilities have to be opened up. Next, novel enabling technologies lower the cost. Sometimes a sudden change in technology with a lot of research happening behind it will make the prices extremely affordable. Whether that has to be adopted, those are the opportunities which are springing up and mushrooming in the market. Next one is threats. So threat can be recalls, means something not working and where to recall. Okay, then consolidating the purchase. So in terms of medical technology, that something is not working, then we can have to be very wary about the medical technology. We are speaking this case especially, but the same thing is applied for any organization. But here recalls is the terms of if the medical equipment fails to perform as much as desired, so recalls may be there. Then consolidating purchase base. Okay, so they will have to see how many installations have already happened, how many have been refused, how many are still in place. So consolidating the purchase with how many people have bought those machinery, that is important. Next is legislative wins, what kind of changes in legislation are happening. Then cost of materials and manufacturing that, whether they have decreased or normally increased. So all these are some of the ways in which one can see at one's own organization in which we are working and derive the strategies. So there could be four strategies. The first strategy being the attack strategy. Okay. So in attack strategy, what is going to happen is integrate in the new schema, influence the patient push, and go all in one key emerging market. So you are opening up. Second is reinforce strategy, streamline the internal valuation processes. How much value has to be given to every individual process? Disciplined portfolio management. Every portfolio has to be separately managed. So you're reinforcing strategy. So that is second strategy. Third strategy is to develop the strategies. Develop strategies are to developing strategies which will have to overcome other things like for track end-to-end healthcare dollar cost or future impact of utilization of the healthcare services. Like in the case of pandemic, we had the first one vaccine, the second vaccine came up. So end-to-end mechanism, how to get the certificate and all, how we are able to manage in our own country, that will serve as a purpose for other countries to also emulate. And then cost value models for comparison, what cost, what at what level we have been able to reduce the cost significantly as compared with even the developed nations, and adaptable business strategies and conducive to multiple scenarios. So that is known as a develop strategy, or the developing the strategy with the development in with the developmental model in focus. So attack strategy, reinforce strategy, develop strategy, and avoid strategy. The avoid strategy, what is me too products. Everybody wants to sell their own product, including the insurers. They want to simply introduce something subversive products, which like generic products and fast follower mentality. Someone who's ready to buy with a impulsive buying purchase, like doubling down on bad ideas and wait and see approach. So all these are avoid strategies. So one has to be really, really careful as far as this sensitive industry is concerned as to what are our strengths, what are our weaknesses, what are our opportunities, and what are our threats, and what kind of strategy are we really have to implement in the first. What has to be charted out and which is good for us. So this is about the SWOT analysis. We have seen portals five forces, and we are seeing the SWOT analysis. One is from the point of view of external forces which are having its influence on the organization. Second one is from within, how one has to chart out the course of action for on our own organization. Then comes your value chain. So primary activities are diagnostics, treatment, and care delivery. The value chain, where all we are adding value, okay, to the patient. How many times the value can be added in terms of along with supporting services, like how HR can increase the value by selecting the good number of skilled staff, how IT systems can add value by improvisation in terms of the applications which we are using and having support services for the cloud-based systems. Then how finance can add value in terms of supporting the EMIs or credit worthiness and all those MOUs which they have with the banks and all those things and insurance companies. So all the supporting activities will have its bearing upon the value chain. Then focus on quality improvement and patient experience. So any amount of ISO certifications, any amount of World Health Organization certifications, other local certifications will be always welcome, provided NABH certifications. So they will be welcome always based upon what kind of quality improvements one has to have and compliance requirements, and one has to certify on them as per the standardization of the policies are concerned. So value chain is much adhered to, and lean healthcare practices. So insofar as the demand is there, only then such services are to be offered. So lean healthcare practices, so that nothing much have to be stored in advance. So as and when it is needed, you can outsource some of the things and utilize them. So value chain in healthcare. Now, so much to say that you can see how this triangle actually is working. Okay. So on the top, you'll have the patient. Okay. On the top, you have a patient. Then you have the institutional providers here. Okay. So main providers of like hospitals, HMOs, ACOs, all the healthcare organizations. Then you got ambulatory services, MD's office, urgent, then retail clinic, all the parts of the hospital only we're talking about. Then we're having nursing and rehabilitation centers, DMI, hospice, then ancillary services like labs, imaging services, DMLT, and lab technicians, on our X-ray and all those things, ancillary services. So all in all, one has to have to support from where life science tools. From the bottom, we'll start with life science tool. Then we have the diagnostics. Then you've got contract research organizations along with whom a lot of research is being done. Then of course there is a branded pharma, then biotech companies. Then we have got something known as the generic medicines, then CDMOs, devices, which we are just now talking about, then contract sales, then the wholesalers, okay, then managers are there, okay, benefit managers. So pharmacy, and they are having their own targets to sell. The insurers will enter in this place. Okay, these benefit managers are going to influence in which you are running your retail clinic. So this is the value chain, which is very complex chain. Then we'll move on to another strategy. Okay, we have just now seen one strategy known as the value chain. Okay, we have just now understood Porter's 5 point. Then we got SWOT. Then we got healthcare value chain. Then we'll understand one more strategy known as the blue ocean strategy. Now, what will happen in blue ocean? Okay, first of all, creating uncontested markets. Somebody who has not been able to venture out, okay, and create an uncontested spaces. First of all, that has to be given predominance. That is, preventive healthcare programs have to be constituted despite a strong refusal or strong resistance from the healthcare organization themselves. We have to undertake on a larger scale preventive healthcare programs, and there should be teleconsultations. Okay, once you have them, there could be reduction in the cost while increasing the patient value. So strategic innovation can fall in place if you follow the blue ocean strategy. Okay, if you follow the blue ocean strategy where nobody has ventured out so far, not going behind the herds, like everybody is going behind the herds. If one opens one hospital, every other doctor is going to open same kind of hospital. Not like that, but something very contrasting to that. Blue ocean strategy is something which is working out very rarely. Now, to make a difference, we'll have the red ocean strategy here. In a red ocean, we all know. Okay, example has been taken by this Umar Essa Habib from the medical medicine in Al Futtaim Healthcare Center. Red ocean strategy is there's fierce market competition. Then there's a value cost trade-off. Then there is competition for the market share. To gain larger market share, there is a competition. They have a target to meet. Then there is something to satisfy the existing demand. The existing demands have to be crossed every month. Then there is short-term profit focus. Everybody is more worried about what they are going to gain in the short term. Next, operational efficiency is unchallengeable. Okay, so the one who approaches this is approaching that with the win-lose approach. Either he wins, fight or flight approach. Okay, so this is what is there in the red ocean strategy. Now, what is there in the blue ocean strategy? Let's try to uncover. The first one is market creation. You are focusing on some things which nobody has focused so far. The first one is market creation. Is there any opportunity? Is there any pain? Okay, or the which you can successfully remove the pain, eliminate the pain points basically. So market creation, a separate market creation. The second one, value innovation. How do you go on adding value in every process? The third one is competition is irrelevant because there is no competitor. In blue ocean strategy, there is no competitor because nobody has been able to find out the solution what a particular organization has been able to find out. Then there is demand creation. Then there is long-term growth. Okay, so long-term growth is ensured automatically. Long-term growth will follow if people are more focused on blue ocean strategy. Then there is strategic focus is maintained all the time. Then obviously there is win-win approach. So if it is done with lot of patience, lot of perseverance, lot of care, then the blue ocean strategy is something which out of the box solution we are coming up and able to develop the strategies based upon this model. So this is one model through which you are finding the strategy. This by itself is just the model through which you are going to chart out the course of action for the hospital known as a blue ocean strategy, through which you are finding out a new strategy. Then you have A balance scorecard. So the balance scorecard is a matrix in which you are going to find out first one financial perspective, second one customer perspective, third one internal processes, and fourth one is learning and growth. Okay, in terms of financial perspective, about cost control and revenue growth, how much we are able to increase our revenue over a period of time after BEP, even after break-even point, how much revenue growth is possible. Next, customer perspective, patient satisfaction, how many have given the good feedback on the net promoter score on a scale of 1 to 10, how many said they are happy, they are going to refer your hospital to some of their friends and relatives also. So customer perspectives are there. That is more important. It is balance scorecard. We are trying to have a balance in all the things what we are doing. The first one is of course the financial perspective. The second one is of course the customer perspective. The third one is internal processes, clinical efficiency and operations, day-to-day requirements, how they are actually the standard operating procedures, internal processes, whether they are smooth, whether they are audited regularly once in a year, or whether they are complying to certain standards, whether certification is gained by renewal. All those internal processes have to be adhered to. Next one, learning and growth, the staff training. Despite being sidelined, despite being ignored, still there is always a requirement of staff training. There's always a change happening. Still there is a resistance from people in terms of the knowledge change which is happening. So all this has to be seen through the lens of the balance scorecard. Okay, so going ahead. Huh. The case in point example being modified balance scorecard in which having the clinical leaning. Okay, so you are having the adverse events, then clinical outcomes of those are adverse events, then clinical morality with which you are handled those things. Okay, then socio-economical. Okay, nosocomial infections or something like that, which I am unable to make out, actually it's not clear. So next one is clinical internal businesses. So we have got accreditation readiness, whether our organization is ready for the accreditation process, like in NABH and various other organizations, like other organizations from the medical council or pharmacy council, all those things. So in there is readmission rate. Okay, then patient's length of stay, how many days they are going to stay. So this is the balance scorecard. We are finding this balance all from financial perspective, marketing perspective, then customer perspective, and then each and every satisfaction. The employee also has to be satisfied at the end. So we are seeing it from the HR perspective here in the employee satisfaction here. Here you are seeing from the customer loyalty, patient experience, how was the overall experience, whether he will refer to somebody else or not. Then providers satisfaction, then critical care capture rate. So all these things is being understood in this balance scorecard. So it will all add up to employee satisfaction, staff efficiency, staff length of stay, how many people are attrition, how many people want to leave and go to better organizations to work with a better salary, then staff ethics and loyalty. So all these things are going to show us one thing, that is a balanced scorecard it is going to show. We have to study all this and come up with some balanced scorecard, some metrics you are going to come up with. So it will give you the financial viability. It will show you the net revenues and cost and inventory turnover and growth in the center. All these things are going to determine your financial viability. Okay, what will be the phase in which it can grow in the upcoming future within the next 5 years, what is going to be the likely course of action, in which direction the organization is going. That could be easily understood by modified balanced scorecard. Then again we'll go out now. Now so far we have handled this inside. Now again pestle analysis from outside. Now pestle analysis we all know. P stands for political, E stands for economic, S stands for social, T stands for technological, E stands for environmental, L stands for legal. So pestle analysis, all the time there are forces from the outside which is going to affect our own organizations, The first of all being the government policies and subsidies, how much of subsidies are being exaggerated or increased or paid up. And second one is inflation insurance models, what kind of insurance models are supporting us. Then social, what kind of aging population do we really have, and what kind of health awareness do they really have. Okay, so that is the social impact which we have. And then we are facing the AI, robotics and telemedicine. Okay, so all these technological advances will decide our upcoming future. Whatever technological advances are happening in this field, AI, robotics and telemedicine, are going to have its own bearing upon all those things, including aging population, health awareness, inflation, insurance policies, each and everything. It will go to affect technological. Next one is environmental sustainability in hospitals. How long and how far the sustainability actions have been severely considered in order to retain the label in the market, so that the aging population will start liking the hospital, and more people are simply coming to the hospital just because it is environmentally more friendly. Sustainability in hospitals. Next one is legal compliance. Okay, the patient rights, the human rights, how the patient has been handled, how the doctors have been taken care of. Okay, whether there is support systems for the doctors themselves, whether there is support systems for the patients. Okay, all these things have to be thought about. So, so in essence, what is all this means? It is a pestle analysis. This is from outside. What I'm trying to tell you, this is from the outside. And first of all, the political force, the economic force, the social force, the technological force, the environmental force, and the legal forces together, we have to study all these things in order to chart out the kind of strategy which our organization have to be able to define. We are trying to define our strategies through these models. The pestle analysis is one such model. This analysis, once you do this analysis, where do we stand? What is our positioning in the industry? Where our organization as a hospital will stand amongst all other hospitals? So we have to study this from every angle. First one is the political angle. The second is the economical angle. The third one is social angle. The fourth one is technological angle. And the fifth one will be the environmental angle. And the last one will be the legal angle. So let's see in detail what are the political factors. Okay. So the political people should be ready for the public-private partnership known as PPPs. They should be able to encourage, adhere, and support all those facilities, healthcare infrastructure. They should develop. How many, district hospitals are there? How many rural centers are there? All those things have to be supported by the political factors. Then comes your global health regulations, WHO guidelines. Okay, how much of funds do they really support, and all those things at the international level, what kind of policies they are set in place, whether how much of that we are using internationally. That is also coming under politics only. Okay, the political factors. Third one is local government stability. The political stability ensures the predictable support and regulation have to be undertaken. Okay, so what kind of predictable support is it? It will be there in the next 5 years. What kind of predictable support and regulations will be framed by the local government, basically municipality and corporations. This is local government, is not the state level government. Local government is the municipality or corporation level government I'm talking about. Next one is subsidies and incentives. Okay, are there any programs which is launched state-wise or launched country-wise for the rural healthcare population in order to take care of specialty requirement like cardiology, oncology, any disablement, partial disablement, or okay, long term or short term, temporary or permanent disability. So subsidies and incentives are taken care by the UDID cards, and all those things comes under your political factor. Okay, unique disability and programs and all that comes under political factor. So the feasibility will see the examination, government support for the healthcare investment, regulatory stability in the target region. So any region is lacking in these political factors. Any region which have been ignored due to the geographics. Okay, any region which has been taken seriously by the political factor. Any region which has been taken care uniformly. Okay, whereby all the development, all the political factors having its own unique influence on the geography. Next one is going ahead. wrong with this. Economic factors. So healthcare spending is how much, what percentage of the income is healthcare spending, what is the per capita income from every city, whether the ability to purchase in a larger metropolitan city is more, or whether tier 2 cities people are unable to afford that much. So the pricing of the particular treatment has to be reduced and all that has to be studied under the economical factor to gauge the affordability actually. Next one is hospital revenue models. Okay, hospital revenue models, insurance based payments, government funding models. So hospital revenue, so all these are economic factors. Then regional wealth disparity. Like, as you can see in the US, there is too much of disparity between the poor and the rich, but not so much of disparity in India. So, and especially developed states are having lesser margin of differentiation between the poor and the rich. So, the developed states have their own identification of identifying the underserved but economically viable market. So, you should know the regional wealth disparity, who can afford, who cannot afford, all those things. Next one is cost of capital, interest rates for funding hospital infrastructure projects. Okay, within how many years it is going to break even, how many years it will take to make some profits. So that is known as cost of capital. Feasibility report says how can you have the projections for the next 5 years, how much the hospital is likely to make the profits considering the region's economic health, also very important. Then funding options. Next is social factors. Social factors, first one being disease patterns. Okay, where the disease is coming from, where it is spreading from, which are chronic diseases like diabetes and health conditions, why country like India is becoming the center of heart conditions. Then second one is population growth. Okay, where do we stand in the world in terms of population growth? What are our urban demands, whether the city is growing like anything, why only India has so many larger cities. And next, third one, cultural sensitivities, tailoring services to the cultural and religious practices. Like this, which is gender specific care, one has to be very careful in order to handle the social factors in terms of gender specific care. Next one is health literacy, whether the literacy and awareness of the healthcare facilities is made available, whether there is advancement in advertisement by the government it is done, or whether private people are doing it, whether doctors themselves are doing it, or support staff are doing it, or who is doing it, the administration. It is the matter of discussion and debate, who will take care of the healthcare literacy programs and how it will reach to the lowest strata of people. So feasibility focus is what? Assess social trends to align services offering within the community and needs and preferences. Okay, so every community, what is their need, what is the preference, it should reach in every nook and corner of the country or the region at least. Next one, technological factors. We are still studying the pestle factor only. The technological factors being the adoption of hospital EMS systems, okay, management systems, then AI and robotics with surgical tools, exact precision tools, the apps, the list of apps which you should make a list of apps which are generally being utilized in the hospital sector, and they should have the telemedicine platforms which you have to be very aware about how to have access to the remote access, including the ambulances which are going from place to place, the planes these days, the ambulance charter aeroplanes are being utilized for that, reaching the nooks and corners of the country. Then telemedicine also being reached through the development of live surgeries being made, all those things, everything is there. So including the call centers and all those things. So whatever our specialists are outsourcing, telemedicine platforms are there. And then medical innovations, cutting edge treatments attracting the patients seeking advanced care. So there are various patients who are waiting to come to India to have their checkup. So patients having treatment which is very expensive in their own country, they want to come. Medical innovations have made all this possible to happen. Then the feasibility is, of course, is to determine the cost benefit ratio. Okay, how much of cost and how much of benefit they are getting in return. Ratio we have to find out. After finding the ratio, we have to find the adaptability of the latest technologies, provided the technology is transferred. So many developed countries, they don't want to transfer the technology. Nobody is readily eager to transfer their technology. So we have to be very careful in order to have these kind of adoption of newer technologies with the cost benefit ratio understood. Yeah, from the technological factors perspective. Environmental perspective. Okay, so sticking to the lead certifications and waste management, then recycling, re-waste, then climate impact, how to deal with sudden impact, mm, from the floods or from the tsunamis or whatever it is. So hurricanes or certain kind of depressions in the clouds, all those disasters which has to be saved. One has to safeguard themselves. It requires a stakeholder with all the supporting people. The entire team has to, like the disaster relief or the disaster management teams have to be able and gear themselves up to handle these kind of sudden effects of the climate impact. Then sustainable practices, adoption of renewable technology like solar power, wind power, thermal power, every source of power, whichever wherever the power is available, all sorts of power you should be able to use it, including nuclear energy. So all the powers, sustainable. You should make it sustainable, renewable, and eco-friendly. Next comes your feasibility focus, of course, on the evaluating the environmental risks and compliance costs while selecting a hospital location. So it should not be something near the sea coast. Okay, so hospital location and design should be enough some so that it can be retained for over a period of time. Okay, so we should be able to have the environmental risks in a specific area. We should not go and start one hospital in the forest region, or you should not open somewhere near the beach or something like that, which is prone to something, okay, like erosion of soil and all those things. So you should be very focused in terms of environmental factors which is going to affect us. Legal factors, finally touching upon the legal factors, licensing and approvals, mandatory license for infrastructure and services, patient privacy regulations have to be complied with. We should provide all the facilities for Divyangs and disabled people. Then we have employee laws on the working rights, 8 hours work, insurance for them, non-medical, how much of insurance they are covered, how many working hours do they have leave on time or not, salary have to be paid on time, ESI, PF, all those things, employee laws have to be complied with. Then litigation risk. So there is always the risk of malpractice. This malpractice have to be taken care and addressed immediately. So litigation risk have to be covered by the legal department. Then feasibility, of course, in the bearing the who is going to bear the costs for the legal. If somebody put the case against the organization, against the hospital, who how to go ahead with the filing of the cases and how to maintain those costs, because every organization has to respond to the legal challenges, including right to information, all those things. So currently we have addressed some issues about how to come up with different level of strategy. I hope at least some number of strategy we have been able to cover today. Uh, there are 30 more slides which other than this we can of course continue with the next classes. Now I'll open for the question and answers in case if there are any. In case there are any questions, we can note down for the next time. We will revise this, and I'll be able to share the slide in the next class. So thank you everyone for attending today's classes. Yes. One and all. We'll call it a day now. Thank you so much.